What? Like, Julie, what did you think?
Oh my gosh, I trying to follow David's tips and not jump to the part where I identified with everybody who was speaking, but I completely felt every word that they were saying. I mean, I also went 6 years without really talking about my diabetes, so I resonated. I just felt that, and so much of what was shared tonight, just even though it wasn't my exact story, um, it just it's the stigma that we put on one person with diabetes affects every single person who is living with this disease, whether they're the patient, whether they're a family member, whether they're a future person with diabetes. And so it made me happy and sad. And I loved the idea of um, recognizing that it's just one part of the story. And I started thinking about how even my experience with diabetes, as broad and vast as it's been, is just one part of me and one part of the big story. So those were some of my takeaways, and I can't wait to hear what everybody else has to say.
I
There's a
know.
lot of good
Okay,
conversation.
here comes Renza.
Hi there. How are
Hi,
you all?
Renza. Hey, Renza. So I want to introduce you to Julie. Julie,
Hi,
this is
Julie.
Renza. Renza, this is Julie. You two should know each other. So after this, I need to connect you.
Wonderful. Great to meet you.
It's great to meet you too.
Wonderful.
And we are sitting here waiting for Tiara and Josh to hop in. But before they get here, Renza, so what are your initial thoughts after listening to the stories panel?
Oh, I always say that I don't think we can ever hear enough stories of people living with diabetes. That lived experience is what I always say, that other people's stories make my own diabetes make sense. And I think that comes from, when people are first diagnosed, and even for some time afterwards, as we heard from Felicity, where we don't want to talk about it, perhaps we're hiding away. When we hear other people's stories, that those feelings of isolation that we may feel can completely and utterly disappear. Sometimes it takes time to connect with the right people and the right stories, but knowing that we're not alone is just so powerful, and understanding that we don't need to hide away, that there is support out there beyond necessarily, the structures of a healthcare system and the support there, because that support that we get from others living with diabetes is absolutely critical. I just feel that it is, for me personally, one of the most important parts of my own diabetes management.
Well, you kind of said something, and we're going to touch on that in just a quick second. So, Tiara, Renza, Julie, Tiara, this is everyone. But before we get started, Tiara, what was your thoughts after listening to the stories from the session?
So I just have to say this because I did not know Felissa could sing like that.
You
so
didn't?
I didn't.
Oh.
So I was like, oh my God, like, can she drop like a few tracks about diabetes? Like, come on, Felissa, we need to get all that talent out. But I caught the majority of her talk, and I think her story always kind of blows me away, especially when she talks about how she had to blog under an alias for so long. And I still haven't heard anyone who's had to do that, but I think that goes into like the shame and stigma that people with diabetes face. I know we're going to get more into it in a few minutes. But her story is like finally someone can relate to my experience of being diagnosed myself.
Definitely. So, icebreaker question before we get started. So, Renza kind of mentioned finding the right time to share your story and finding the right people to share with. So, Julie, starting with you, then Renza, and then Tiara, when did you find, like, what was that moment in your life for your diagnosis that you said, you know what, I just need to talk about this, and these are the people that I feel comfortable with?
Oh, I feel like this is going to be such a sad story. It took me forever. I was diagnosed at 21 with type 1, and I knew nobody for like 6 years that also was my age and had type 1. And so I felt very isolated, and I didn't know where to turn. And my husband would point out people who were wearing insulin pumps and be like, go talk to them. And I'd be like, okay, I'm an extrovert, no problem. Hi, I'm Julie. I also have type 1. Can you tell me about your pump? It was so awkward. But after I started volunteering with the American Diabetes Association, I started to meet some people. It turns out almost all of them were people in the diabetes online community. And knowing that they were out there, none of them lived near me, but knowing they were out there and that they were sharing their stories was the complete shift that changed everything about my diabetes management and my life with diabetes. And to this day, I'm so grateful that I found them. And some of them even let me write on their blogs or share my stories, but them sharing their stories was what helped me overcome like a half a decade worth of being in the closet. Like it was really important to find those people, and thank goodness for the internet.
So what about you?
Well, I was diagnosed at 24, so and you know one with diabetes. You know, I remember there was a girl at my primary school, I think, who had type 1 diabetes, and then I got a type 1 diabetes diagnosis. I knew nothing about it. It totally did not fit into my plans, and I certainly didn't want to ever talk about it, really. And then I got a job working at a diabetes organization, and suddenly I was the here's one we prepared earlier. Every time they needed somebody to talk about diabetes, or type 1 diabetes in particular, they drag me out. And but I guess it wasn't really until I met Cherise that I became comfortable and understood that actually I didn't just need to talk about it from the perspective of, you know, someone in a diabetes organization hitting the right notes all the time, and I could be really very authentic and swear a bit and a lot, and talk about the stuff that's not all that great, as well as being able to celebrate it. You can actually celebrate diabetes. You can cry about it. You can cheer about it, all of that. But it was meeting Cherise online, and then actually I was so fortunate that not long after we found ourselves at a diabetes conference together that I actually got to meet her. And you know, I can't talk about diabetes community and the value of this community as a forum for sharing stories without speaking about Cherise. She's heard it all before. So I'm sorry, Cherise, you've heard it all before.
Oh, yes. And every time, like, Renza, stop it.
No,
Like, stop
never
it.
will.
And Tiara, what about you?
So I was diagnosed at 25 with what I thought was type 2 diabetes. So I was already open about sharing things about my health anyway. Like at that point, I'd been sharing like stuff about like my weight loss and cooking and stuff like that for a few years at that point. So I was totally on, game to talk about type 2 diabetes, because I didn't see anyone else who was my age and diagnosed with type 2. In fact, I really didn't see a lot of people talking about type 2 at all on social media. And this is when I'm still primarily on Instagram, but this was when I was just all on Instagram at the time. I had family members who had type 2, but no one was really like open about it. Like, oh, are you on metformin? Are you on insulin? Like, how does this make you feel? What are your experiences like with your healthcare providers? And I just feel like I feel grateful that that part of me just hasn't waned. Like, I'm still always interested in sharing my story if it's going to help someone else. But I never felt like I never felt like me getting diabetes was my fault. I just felt like it was probably time, because I had pre-diabetes when I was younger than that, after my freshman year of college. So I felt like I was going to get type 2 diabetes eventually. And also because I was in grad school at the time, I knew a little bit about diabetes. So I knew like it wasn't me a person, and it's known as a person, that's for why you get diabetes. But like, I knew that because this is just how the disease works, that not my fault. Let's just do whatever I need to do, and we'll figure it out one day at a time. I did go through a little bit of a denial period, but I think I want to say that for when we roll into the actual sessions. But yeah, I've always been open about my story because I always felt like it would help someone else.
So this brings me to this question. So we've all been in the space, and I don't want everybody to speak at once, but I think it's important for us to talk about this in order for us to get through the conversation. So as people living with diabetes and being in the social space, and heck, even in sometimes your kitchen during family gatherings, do you believe that diabetes stigma truly exists? And if so, can you provide an example? And Tiara, we'll go ahead and start with you first.
Absolutely, it exists, especially for the type 2 community, type 1 as well. But like, I'm because I'm mainly working in the type 2 aspect, I see it all the time. Like, and it's both internalized, and it's also unfortunately validated by healthcare professionals who are supposed to help you manage the disease instead of attaching your own personhood to the disease, if that makes sense. You know, you hear it all the time, like, you did this to yourself because you made bad choices, without giving context to how those choices were made and the circumstances for which people are subject, right? Like, so if you're talking to a family that doesn't have a lot of fresh foods around, or they don't have a safe area to exercise, or they don't have access to a doctor to get preventative treatment, like, how is any of that their fault? Like, why would you assume that they chose to get a lifelong chronic illness that you're going to have to manage for the rest of your life, and that comes with some serious health conditions when you're unable to take care of yourself? So yeah, it absolutely exists.
Renza, Julie?
Well, yes, of course it exists. It really definitely exists. And I think I don't think I necessarily realized that until sometime later, but you know, I was diagnosed 23 years ago, and I can still remember that underlying message that my very first endocrinologist shared, which was, if you don't do what I say and follow it to the letter, you will get diabetes complications. And with the implication that all the bad stuff was going to be my fault. The good stuff was going to be to his credit, but the bad stuff was going to be my fault. And it took me a long time and quite a bit of therapy to realize just how impactful that had been, and why, you know, I had my annual diabetes eye screening yesterday. And the anxiety that I feel leading into that is because I feel that, well, one, I'm concerned that something is, you know, I'm going to be diagnosed with diabetes-related retinopathy, but also because I feel the blame and the stigma and the judgment that will be thrown my way if that is the outcome. And I feel that this is bubbling under the skin all the time. Because that was that message that I got at diagnosis. And I just always find it just so incredible at how impactful those words were and how much they've influenced the way that I felt about my own diabetes. And when I'm talking with healthcare professionals, and I get to do that quite a bit as part of my job, I do remind, you know, that ridiculous saying, a lifetime on the lips, what is it? A moment on the lips, a lifetime on the hips, or whatever. That's, you know, all about shaming us into only eating leather sleeves for the rest of our lives. But actually, a moment on the lips of, you know, words that can stigmatize us will and can impact us for a very, very long time.
Definitely agree. And Julie?
Yeah, I was just going to say, I think it's interesting that you both brought up the medical field because, at the beginning I said the stigma that impacts one person with diabetes affects all of us. And I will never forget having a physician ask me if I had real diabetes. I didn't even know which one she meant. I thought they were all real, and I know now that they are. And it was just so jarring to me that somebody who had a medical degree wouldn't understand that. And then 10 years later, to be asked by another doctor if I wanted to get off insulin because she thought I had been misdiagnosed. Because how could somebody who weighed as much as I did have type 1? Used those words, and shared with me that all the people she knew, all the patients she knew with type 1 were skinny. And so not only was I stigmatized by the weight comment, but I was stigmatized by the diabetes. And, it's just so pervasive in our society. And it is definitely real. And whether you can easily brush that off or respond like I did to the first physician and I did ask her if she had a real medical degree. It still sticks with you, and it has stuck with me for 2 decades. It's really impactful, and it hurts, and it just continues to drive that self-doubt and that self-blame.
So it's Felissa mentioned during her talk that she goes through it. She hasn't gotten over it, but she kind of just pushes through it. So it sounds like Julie, Renza, and Tiara, that you're just kind of pushing through it, and it's almost like it's giving you kind of like permission to go out there to make sure nobody else experiences, the things that you went through. I mean, Renza, you with Language Matters, Julie with all the volunteering you've done, and Tiara with all the communications that you have in the online space. So since we're talking about the online space, and I want to make it very clear that I could not find someone with type 2 to participate in this panel discussion, which probably, I think Scott kind of mentioned it in his comment, that the lack of conversation in the online space around type 2 is huge symptom that stigma does exist. And I know we've seen it firsthand and what that looks like. So trying to explain to someone with type 2, hey, we're going to have a conversation about stigma. It's we're not there yet, but hopefully we will be. I think just seeing more people with type 2 sharing their stories online in an open space, to me, speaks volumes of how far we've come, at least 13 years ago. So how does social media play the role in stigma when we think about, people sharing stories through pictures, people sharing stories in comments, people sharing stories, tweets, podcasts? How does that play a role? And when we think about it, I don't want you just thinking about, the media, but how the community itself plays into stigma, because I want to make sure that everyone listening understands that this is a huge issue and it doesn't exist outside of people, or only exists with people who don't have diabetes.
I'll start. First, I want to add something that Julie said. Julie, I was also stigmatized about my weight. I am not a thin person, but the number of times I've been told to just lose weight to get my diabetes under control for me, it's so frustrating because I've told doctors, I'm like, look, I know I'm not skinny, but actually my weight isn't the problem. It's probably I need adjustments to medications, and I probably need more help in education. And I just get like, well, you can eat a healthy diet, and I'm like, I eat healthy and exercise all the time. Clearly, I need more help. So I totally understand where you're coming from there. I would say, Cherise, the way that social media can play a role, I've seen people make statements like, hey, I have reversed my diabetes, and if I've reversed my diabetes, so can you. And it's you know, and I understand that I think the intention is always good, but the impact that it has on someone who won't be able to put their diabetes into remission, which is the correct term, someone seeing that and be like, oh, I can do it too, when they realize that they won't be able to put it in remission, that can have an impact that's like, oh my God, this really is with me for the rest of my life, and I'm gonna have to pay super close attention to it for the rest of my life. Even though people with type 2 who are in remission also have to do the same thing, but the mindset around those two concepts differ. And what I think what needs to happen is people need to be more, or we need to promote the concept of being comfortable that, yeah, diabetes is part of your life, but it's not your entire life. And you can continue to live a healthy life with it. For me personally, what I've experienced on social media, like, I've kind of drifted away from social a little bit recently, because I found myself comparing myself to other people, sharing their what looks like to be perfect A1Cs and talking about how they don't have to use as much insulin. And I'm like, yay. But something that was triggering for me was when I started wearing a pump, I actually realized how much insulin my body really needed. And that made me feel like crap, because here I am going through vial after vial. I wear Omnipod, so it lasts about 3 days. I was going through them in like a day and a half, 2 days. And I was like, well, I'm clearly doing something wrong. You know, I'm using way too much insulin. I'm not like, everyone is bolusing for like 3-4 units, and I'm bolusing for about double, sometimes more than that, per meal. And it made me feel like I wasn't doing something right in my life. And I think that, again, I think people share their stories with the best of intentions, but I think kind of showing like you're only the good stuff with diabetes can also be a little triggering when people kind of want to see something that's a bit more relatable, which is sometimes the imperfections of living with diabetes. So I know for me, I want to see how you act on a bad day, because it makes me feel more comfortable to share when I have my bad days, because now I know we're all in it together. But yeah, so that's how I've seen social media kind of stigmatize diabetes.
Can I don't, and I may be an outlier here, but I really struggle with the term remission when we're talking about type 2 diabetes. I don't have type 2 diabetes. I don't want to speak for people with type 2, but my understanding of remission in the cancer world is that it means that you are no longer needing treatment, no longer needing meds. When we're talking about remission in type 2, it doesn't mean you can not think about day to day how you're looking after your condition.
Right.
And it was actually my CEO at Diabetes Australia who cornered me one day when we were getting on a flight to go and do something. And he's delightful, but he was in full force here, you know, really why this was problematic, and saying, well, you know, Renza, you keep telling me that you're using a DIY system and that your time in range for the last however long has been 100%, and rah, that's great. So does that mean that you're in remission? Does that mean that you've put your diabetes in remission as well? Because that's the thing. We say when people with type 2 are in remission, it's because their glucose levels now are, you know, normal.
Right.
But you're saying that you get that as well. So are you in remission now? Like, don't be ridiculous. I've obviously got to still wear all these things connected to me and think about what I'm doing. And I just feel that when we use that, it sort of makes it feel like, oh, well, it's gone away, you don't need to worry about it anymore. But
Right.
the people I know who have put their type 2 diabetes in remission are still working so hard.
Yep.
And that, again, is another way of minimizing the effort that people with type 2 diabetes take every single day managing their condition, however they're doing it and whatever their outcomes are. If they've, you know, put it into remission, awesome, but also they're really struggling with their glucose levels and they're being judged for that. So I don't know, I just, every time I see it, I feel like, what are we doing here? What have we done here to add stigma to people already living with such a horribly stigmatized condition?
Yep.
Renza, to me, it's kind of like so yes, some people can be in remission, or some people can prolong, you know, need an insulin or whatever on type 2 diabetes, or can, you know, take a half a pill a day and be fine. But to me, it's like, what about those people who need insulin, like who have type 2 and they need insulin. And it goes back to these, oh, well, you didn't take care of your diabetes, so we're going to put you on insulin. And it's like, that's not right. So for me, it's like, why are we giving people false hope when they see stories of put your diabetes in your type 2 diabetes in remission? Because I can tell you now, my husband's upstairs, he has type 2, and he does what he needs to do, and guess what? His body still needs insulin. So, and then just on a personal side, so I have LADA, and for the first like 3 years of my diagnosis, I was on oral medication, and that was the hardest part of managing diabetes that I ever had, that I wish someone would have told me, or my endocrinologist at the time would have said, hey, let's just put you on some insulin. Because I didn't have insulin when I went high. I didn't have insulin for all of these different things. I had to go outside and walk. So I think that, like you said, we really need to really think about what the journey is for someone with type 2, no matter how they treat it, especially since in the America, over 5 million people with type 2 are using insulin. So,
you know,
but I'll throw it back to Julie because I keep going.
Oh, sorry. Go ahead, Julie.
Make your point.
I was gonna say, like you know, like Renza, I also struggle with how we celebrate certain diabetes accomplishments and milestones. So one thing that's really big in the type 2 community is the accomplishment that you've gotten off of insulin. Your doctor tells you, hey, you don't need any more insulin. You can stick with a GLP-1 or oral medication. And there's, I don't know, there's like the line of like, great for you. You did all of this work to reach this important milestone. And then there is extrapolating that to every person with diabetes. And I see sometimes the latter being pushed. And I also think that is stigmatizing for the reasons why, you know, Renza said about giving false hope. When it really is like your diabetes may vary, and whatever milestone you reach, that's awesome for you because you did that work, you put in that effort, you should be proud of yourself. So I hope that makes sense.
Absolutely. What I was going to share about social media is, you know, there is a good side and a bad side to everything. And I think that what we learned today is that either of those sides is enough of the story. You know, I think social media plays an incredibly important role, giving us aspirations, like maybe someday, you know, somebody who's living with type 2 can go off insulin or manage with just diet and exercise. You know, there's recently an Olympic gymnast who was diagnosed right before the Olympic trials. That is so exciting to, you know, little girls everywhere who also have to wear a CGM and manage their diabetes. It's, you know, it's wonderful. And I love that it gives us that encouragement and that, you know, positive side that people who are living with this disease of any type can do anything. But I think what's really missing is the lack of information. You know, the point that nobody chooses this, whether they want to be an Olympic athlete or not. Nobody chooses this, whether they're a couch potato. It's not, and we're not celebrating or even talking about the challenges. You know, we've been on this discussion for 25 minutes, and I don't know about you, but I've checked my blood sugar at least 5 times because my insulin pump is beeping. And I often think, you know, if we could just somehow figure out a way to bottle every single detail and moment that we are dealing with our diabetes, people would be so much more empathetic about what we're dealing with. You know, my poor husband was up all night listening to my pump. I slept right through it. But the people in our lives are affected by this too. And, you know, the more we tell our stories, the more information we can provide, the better picture we can create for destigmatizing what life is like with it.
And you know what's also interesting? So when we talk about the family dynamic, so my daughter, she's has this huge Discord server. It's funny because it's like I'm looking at little me sometimes. And somebody was talking about diabetes and food. And she said, no, that is not true. And they were like, well, how do you know? And she was like, well, my mom has diabetes and she does a lot of stuff on social media, and that's not true. So for our kids and our family members, that even though we probably annoy them with everything that we share, but it goes off, and it, like David said, it has legs. She's able to go tell my story and make it relate to, her discourse server friends. So I think that the stories that we share are very, very, very powerful. And the more stories that we have, and the more diverse stories that we have, from struggles to triumphs, like those stories, we need them. So if you all could, I'm putting you on the spot, think of one story that you would like to see portrayed, or even someone to share on social media. I know we've all been in the space for quite some time. What is something that you feel is missing?
I think
or that you haven't yet run across?
I don't think we talk enough about, I think that there is such a simplistic view of what diabetes is outside the diabetes world, sometimes even within the diabetes world, but certainly outside of it, that it's all about sugar, it's all about insulin. I don't think that people understand the emotional load and burden that we carry. And I don't know how we necessarily, we ran a campaign at Diabetes Australia last year that looked at, was really trying to push or get out that message of 180 decisions a day. And that is huge. That is truly remarkable. The burden that we carry every day to manage this condition is significant. And I don't think that people necessarily realize that unless you're living with it or very closely living alongside it. That's the message that I'm always trying to get out there. And also that one of the things that really contributes, and everybody is different in terms of what that mental load is and what contributes to it, but one of the things that contributes significantly is the stigma that we're experiencing. That absolutely, adds to the day-to-day tasks that we need to do and the mental load that we need to do that comes from those tasks. But then we've got all this external messaging about what diabetes is, and just having to either hear it, or if we decide we want to, combat it, whatever it is, that adds load too. So that's the message that I think that I'm always trying to get out there, is that mental load as well.
Yeah, I think what I would like to see are stories of the family members and friends and colleagues of people with diabetes. All of us on here have diabetes, but we all know diabetes doesn't just impact us; it impacts everyone. So I think if we're going to address the stigmas associated with it, it can't be just us who's always talking about it. It has to be, our support system, or people who may not have any personal or super personal connections to diabetes, but may work in the space or may just have heard about it, like hearing those stories about what they've learned and how, and what surprises, they've learned about diabetes. I think, I certainly have family members who know of diabetes, but they don't know diabetes, and the questions that they ask me about it are still can you eat that? And that's when I have to put on my community advocate hat and say, yes, I can. Let me tell you why. And that I get into like a long diatribe about it, pun intended. I get into a long diatribe about it.
Thank you so much for that.
because I want them to learn. But I also realize that maybe it's not me that always needs to be telling these stories or giving these perspectives. It needs to be them eventually. They need to go out and tell someone, at work, like, hey, I read about this. We all know about diabetes. Did you hear someone tell a diabetes joke? Maybe don't do that, because I know someone who does. Or maybe I don't know anyone, but chances are there's someone in this room who probably has it and is hearing what you're saying. And what they're hearing you say is, this disease is a joke, and it's not. So I guess long story short, it's not just us. It needs to be the people outside of us. It needs to be a truly public health like campaign or issue, but not just by people with diabetes.
I'm so sad that David is gone, because I think the best idea for a story, a movie maybe perhaps, is, this 180 decisions we have to make each day that is an addition to what everybody else has to make. I think trying to discuss or capture in some way the imposition that this becomes as it is part of our daily life. And in that, the fear of the stigma, the retribution, with employers, that is incredibly real. And, I was thinking about why some folks with type 2 may have been reticent to join us tonight to share their story. But I think anytime you put yourself out in a public space, my mother always told me stories about putting myself out on the internet. There is this fear that, maybe my boss will see this and decide I can't do my job the way he thought I could, or she thought I could, because of my diabetes. And I think that it's misinformation, but that fear is very real. And I think that, it's not a positive story to be told, but it's one that is real and impacts people.
Definitely. So since we're talking about media, sorry, my dog is barking, and outside of people with diabetes, Renza, can you tell everyone about a campaign that you all I think it's still, did it end already? I think it may have just ended, but it's diabetes and stigma campaign over at Diabetes Australia, and I'm going to get my dog to stop.
Yeah. Yes, last week, Diabetes Week here in Australia, and our campaign was all about diabetes-related stigma, and so we did well, actually quite a lot of different moving parts to the campaign, but I think the two things that I saw the most feedback to were two short 30-second videos that we made, and I'll share the links in the chat there. But we, as we do with all our campaigns, we spent a lot of time speaking with people with diabetes and hearing the same stories from people, and those stories were things like being asked, should you be eating that? We heard people with, some really negative stories from healthcare professionals saying, you brought this on yourself, and a number of other things, and how it makes people feel, in the workplace. Do you have to do that here when somebody is sitting at their desk checking their blood glucose or injecting insulin, whatever it might be? But the thing that I found really, really interesting when we were developing this campaign and the videos was that when we had made the videos and we were sending them out for testing, and people with diabetes all came back and said that really hits a note. I see all or some of those comments having been directed to me, and people without diabetes coming back and saying, really, that seems pretty harsh. And there was this real disconnect between our experiences, which were, yeah, happens, and people thinking, oh, that doesn't really happen, or that doesn't really matter. And one of the little vignettes in there was somebody sitting there watching TV, and there was a cooking show, and it's like, oh, look at that looks great, it's diabetes on a plate. But what the really sad thing about what so much of what we heard once we put this out was, we heard people with type 1 diabetes saying, well, that I've heard all of that, and it's because people think I have type 2 diabetes. And I wrote a piece beforehand saying, we kind of need to look at this from the perspective that, unfortunately, some of the stigma in the community that's aimed at people with type 2 diabetes comes from people with type 1 diabetes. I own that. I used to do that. I'm horribly ashamed of it, but I can't in good faith say this is happening without saying I was part of that problem. but the flip side of that we need to ask is where did that come from? Where did people with type 1 get the idea that we can stigmatize people with type 2? And you know where it came from? It came from exactly the same places that people in the general community have when they're stigmatizing diabetes as a whole. It comes from the media. It comes from diabetes organizations, because for too long our campaigns used to be all about that personal responsibility without looking at the structural and things that we've built around that. It comes from health professionals, whatever it is. So whilst at the same time that I say people with type 1 have to own this a little bit, parents of kids with type 1 have to own this a little bit, because every time you jump in and say, my kid didn't get diabetes because they're overweight, you're saying that people who got type 2 diabetes, that's the reason they got it, they deserve it, it's their fault, move on. So I feel, though, that, this issue around stigma, what we've highlighted it really well, I think, in this campaign. Do consider my bias, but I think we did a great job of it. But we've still got a long way to go before we really eradicated the sins of the past, which have come from the community, have come from, as I said, organizations, healthcare professionals, healthcare bodies. There's a lot of work to undo there.
Mm-hmm.
Renza, to your point, I was recently at a food truck and one of the menu items was diabetes sticks. Right. And I was like, what? And of course, I posted it on one of the diabetes communities that I'm in, and half the people thought it was funny. And the other half were completely offended. And so, part of that ownership is on us and how we are accepting or not accepting of messaging.
What are diabetes sticks?
Oh, they were like fried dough with cinnamon and like chocolate dipping syrup. They actually sounded delicious.
That sounds just delicious. Why don't they call it delicious sticks? Because that is
definitely a stereotype that needs to change. Like, delicious food does not doesn't have anything to do with diabetes. Right. Stop doing that. Yeah. All of us eat delicious food.
Yeah.
Like, come on now.
Definitely. So I have a special guest, Josh. I'm going to bring him up in a second, and he's going to read a poem. So before I do that, and before we end and go into Q&A, I want you to think about this, and I want you to complete this sentence, but we're going to wait until after Josh is finished. In order to end the stigma, you're going to fill in the blank. So I'm going to bring Josh in. Remember, in order to end the stigma, and for those that still listening live, I want you to fill in the blank or complete the sentence. In order to end the stigma, blank. Okay, Josh, I'm bringing you on.
Hi.
Hi, Josh. Welcome. How are you doing?
I'm doing great. I've really appreciated being able to listen to all of your stories today. I was also really appreciative to get to do a deep dive into the experience of diabetes and the people around me and everybody on the internet. Hashtag Reddit is amazing.
Oh, I was in Reddit today, and don't get me started on Reddit. But let's go ahead and hear your beautiful poem that I had the pleasure of reading earlier today.
Yes. So it's called Take It In. I wouldn't say lazy. I'd say seeing red, my blood boils. I'd say angry if I had to pick a feeling, an outlook, a way of life at the top of my emotion/spirit list. Of course, I went through the other steps of grieving, disbelieving, because I didn't even feel the disease, just a little bit dizzy and a little bit thirsty. And of course that turned to please, don't let this be real. But it was, and it is. And it seems like it always will be. Stomach, pancreas, liver, blood, misaligned dominoes of flesh, thud, 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 falling inside of me. You have diabetes. Okay, then I was angry. Where was my sin, the rot in my soul? Because I know diabetes. It's fat, lazy, unaware, balloon people whose legs fall off because they have no self-control. But I? Okay, maybe the occasional Arby's, and big bones run in my family. But can we make a deal? A barter? A bargain? A trade-off? Don't take this from me. And that was the start of my life as a number. My skin full of pinholes, my blood full of math. My CGM, my A1C, no DKA, Take TZDs. Shit, I'm at 200, now 153. Is this just at random? God playing with me? I hate it. And it's work. Constant hunger, excessive thirst. I miss buffets. I miss Taco Bell. If that doesn't make you depressed, how's this? I'm so tired that my version of peace is a cool, quiet place to poke a needle in my skin without someone making the same goddamn joke about me doing heroin. And these are the people who'd say I'm his friend, who don't even listen. Again, you just need to do X and then you'll be okay. Repeating false hopes like a gut punch replayed. Chromium and cinnamon, hydrogen peroxide and magnet shoes, glimetrol herbs. It's Facebook true. But God grant me serenity. I accept that I'm not alone in this flood. That for every 10 men I see checking their watch, one of them's checking their blood. That for every pregnant woman who's obese, non-white, or over 25, there's a chance while she's busy growing that life that her glucose is on the rise. That my roommate's first boyfriend always had orange juice just in case. That my parents' dad couldn't feel his foot bleeding, then stopped breathing, had his heart valve and carotid replaced. That the father of the bride had 2 metal legs. That the baseball coach now eats broccoli. That my neighbor had a block in his infusion tubes and was over 400 before he got some insulin. That my student pulled through 5 all-nighters trying to get an A, knowing that she'd take a hit when her lab results came in. So here I go, getting all angry again, when it attacks my blood while you attack my pride, as I fail to control unstoppable pumps and forego comforts like a monk, while you say, why don't you just be different inside? Because it's easy, exercise and diets, fix fat and lazy, pearls meet swine. That's your view, but in reality, you want an easy pivot from seeing the reality that's mine. Take it in, the pricks and needles, doctors, drugs, blood every morning, every hour, every meal, ketones, glucose. Are you absorbing? Take it in. This is not simple choices. Take it in. This is not moral failing. Take it in. What I control, what I don't, the dangers and the stressors that compound my ailing. All let go and miss the normal excesses that make life lived. All that I fear, drugs, tools, insurance, my own body that I must accept and forgive. All those around me I need to, who headshake at tired eyes and discolored skin. All those who judge me as I try to live while my boils inside me, my life. Take it in.
Woo! Woo! Josh, I don't think, I am so glad that you were able to come on because I could not have read that and put the emotion in it that you, whoo, I almost wish I had a tissue because like the tears, the, whoo, I felt it from, yeah. I'll let somebody else talk because I need to catch.
I really felt the part where you said like your student pulling all-nighters because they're trying to get an A knowing their lab's going to take a hit. I felt that. That just took me back to grad school and managing diabetes. That was amazing. Snaps.
Well, it's for all of you.
Thank you.
And thank you for fighting.
Thank you. How long did it take you to pull that together? Like,
it took me 3 days to research and 4 hours to write.
Wow.
Josh, is that available online somewhere so that we can share the crap out of it?
Yes.
I sent a PDF to the organizers, so y'all have the text.
I was gonna say maybe we can get permission from Jim and maybe it'll be up on the diaTribe website, and then once it's published on there, we'll make sure we get the links out to the team or to everybody to share, because it's funny because I live with diabetes, but every time I hear somebody write or talk about diabetes, I'm like, holy crap, like I can relate. And it just makes me look at it differently when I step outside of myself to hear someone, especially someone who did research, and you conveyed a lot of the emotions, like the grad school, the student in the grade. I mean, I've heard plenty of times where parents are talking about their children's trying to, you know, get some sleep, but they can't because their blood sugar's low, or even as an adult, finishing school and trying to get up and go to work the next day after low blood sugars. I mean, and the big bone, you see it all the you hear it all the time, especially in the Black community. It's, you know, my family is naturally big, so I'm going to get this. I mean, oh, yes, that was beautiful.
I think, Josh, you like, yeah, I'm right there with you, Cherise. Like, Josh, your poem kind of laid out everything that we have to, or most things that we have to go through day to day. And it wasn't until like hearing you say it that made me go like, yeah, we do have to worry about these small decisions every day, but it's just become part of our lives. And sometimes I don't even know how we manage it as well as we do sometimes. So thank you for your poem.
So Josh, while I still have you here, if you would like to complete the sentence, in order to end stigma, blank.
In order to end stigma, people need to see how they're like each other.
That's deep. Do you have a website or where we could like follow you, social media? I mean, I guess we can also put that on the website as well with your poem, but just curious.
I have an old defunct poetry website called it's not cold enough for shoes.blogspot.com. And it's my name on Instagram. Every once in a while I post something that's like 5 pictures and a hell of a lot of text. So Instagram is probably where I put my closest thing to poetry nowadays.
Okay, I am going to start following you, and I'm pretty sure there are other people that are going to start following you. But thank you so much for gracing us with your words. Beautiful, just beautiful.
My pleasure. Thank you for giving me an opportunity to dive into your experiences.
Oh, not a problem. Feel free, if you ever want to dive in deep, let us know. We'll let you in.
Just come. This is what I do. Come and grab me if you know anybody suffering with anything that wants me to reflect their experiences. This is what I'm good at. So.
Well, thank you.
You don't have diabetes?
No.
Oh, wow.
Oh.
Oh, I thought you all caught that when he said I did the research and yeah,
Well,
no, he does not.
Even
Man,
bigger wow.
You really did that then. Yeah. Okay.
We see you. So, Renza, Tiara, Julie, in order to end stigma,
mine is that we need to hear stories. We need to hear diverse, lots of stories outside our community, and they have to be through us. They can't be through the lens of, you know, researchers talking about us, health professionals talking about us. That's all great as well, but it has to be our voices elevated and heard, because I don't think that our stories are, you know, we hear it in the community. I don't think we're hearing them enough outside of that.
Yeah, I would say to end stigma, we have to stop blaming ourselves, and we have to stop blaming others, and we have to tell really honest stories, the good, the bad, and everything in between. Or maybe let Josh tell our stories, because that was amazing.
I know it's funny because as he was reading it, so usually when we have like the lightning talks there, we have an artist and she draws everything out Could you imagine if she actually took Josh's poem, listened to him read, and actually drew it out and like put that along his poem, and we put that on the website? I the Learn team is on here listening. Jim, Matthew, team, that would be phenomenal.
In order to end stigma, we need to give people a space to be vulnerable about their challenges with diabetes. Shout out to Brene Brown. Definitely read some of her work, because when we're vulnerable, we give other people permission to be vulnerable as well. And we know that no one's life is perfect, especially if you have diabetes. We all have our down days with it, and I think we need to be open about that. And also, in order to end stigma, we need to be more open about the structural things that contribute to the incidences and prevalences of diabetes. I mean, point blank, we all know that sharing diverse and inclusive stories matter, and actually being willing to address the racism and discrimination that contributes to our abilities to get fair treatment from our healthcare providers, even being heard from our healthcare providers, access to certain devices, even just trying to get diagnosed or getting the tools that you need, like such as like food and whatnot, to make sure that you're managing diabetes well day in and day out. So in order to end stigma, we need to be vocal about that as well.
Definitely. Renza, did you go?
I've been. Yeah, I was just talking about telling stories.
So everybody's been. Oh, okay. So this, I don't know about you all, but this has been fantastic. So I am going to open it up. If anybody wants to leave the chat and come over and share their face on the beautiful screen with us, we would love for you to join us. If you have questions for Julie, Renza, Tiara, they are open book when it comes to diabetes. So feel free to ask away. I do have a question for everyone here. First, I'm gonna start with Renza because it's about the campaign. Will you all, like, if you can give me a quick Twitter summary, what was the decision that what made the organization say, this is what we need to do and this is why, and now is the time?
So this is year 2 of a 3-year campaign around mental health. So last year it was all about as I said, the 180 decisions a day that we make and what sort of burden that adds. And this year it was stigma. And as with, most things that, come from the organization, and I would hope that come from most diabetes organizations, it's because we listen to the community and we hear what they're saying. And what they were saying was that there is not enough of a light shone on the mental health implications of living with diabetes. We're very, very fortunate in Australia to have the Australian Centre for Behavioural Research in Diabetes. And Diabetes Australia works very closely with that organisation. And so Professor Jane Spate is the foundation director there. So we have this organisation that is exclusively there to research, the behavioural aspects of diabetes. And it just adds such a weight to what it is that people with diabetes have been saying for so long, which is, this isn't just about our numbers. It's not just about A1C. And so what we were hearing from them in their research is that this is something really important, that stigma is absolutely, essential and critical as a conversation for us to have with the broader community. So that is why it was the focus of this year's National Diabetes Week campaign. And really importantly, not just something that we run for a 7-day campaign and then we forget about it. So all of last year we were talking about, that decision-making process and the mental health burden. We spoke about it when we ran a campaign around hypos. It wasn't about, this is what to eat when you're hypo and when you're low. It was about, how do hypos make us feel? And I'm not talking about the shakes and the sweats. I'm talking about, how does it make us feel emotionally? And so it will, I guess, weave its way through everything that we're talking about now for the next 12 months. Will be this stigma, and beyond will be this stigma and the implications of stigma on our diabetes management.
Thank you so much for sharing. I know I've said this before, but your campaigns for the last 4 years, I have been an avid supporter, and I don't even live in Australia. So keep up the good work. I see you over here, and we need more of that over in the States. So my question to Julie and Tiara, and right now, so we're in the midst of our D series, and there are a lot of people who participate in the D series, you know, watching. And Renza, you can piggyback after Julie and Tiara. What would you like our participants to know about stigma and the stories that we share and we hear? And I know that's a lot, so we only have a few minutes, so you gotta condense.
You said what should our participants know about stigma?
What do you want them to know? And the stories that we share.
In the stories that we share. I think I would love everyone to take away that to be mindful, and this is definitely more of a shout out to Renza, I think here, to be mindful about your language and read about how language can be perceived. There are actual resources on it now through the Language Matters movement. ADCES also has a language guide that people can refer to. I highly recommend taking a look at that because we don't say things like diabetic or adherence or control. And I even had a conversation recently with someone about the term accountability. Where accountability can have like a more negative connotation because it doesn't allow for failure. So how about instead of saying accountability, say things like empowerment. And when it comes to the stories that we share, please understand that if someone is sharing their story, they have probably gone over that decision a million times before they decided to join a panel, press publish on their Instagram or blog or whatever. So basically what I'm saying is if you see someone making a rude comment, please help address that. Don't leave someone out there on an island to fend for themselves. And if you feel like you've accidentally stigmatized someone, like I think we all know our intentions can be good, but you realize that you've made a mistake, just apologize and then see how you can improve.
I think those are very thoughtful and great points. I just, for those people who are in this conversation who aren't impacted by diabetes, I constantly encourage folks to consider the fact that nobody chooses to have diabetes, and diabetes never acts the way it's supposed to. So you can take your insulin, you can eat the right thing, it's still gonna go out on its own course and do what it pleases. And the grace that is required in dealing with that, both as the patient and as somebody who's dealing with the patient, is huge. And I think that the more we continue to educate ourselves, the more empathy we can have, because there's so much to this story. I just keep going back to that initial TED talk that we heard, that one story is so dangerous because there are 34 million American stories about diabetes, and each one of those 34 million Americans probably 150 stories within their diabetes, if not more. And so we just have to keep just have to keep those stories alive. We have to keep them alive, and we have to keep telling them, and we have to keep using them as tools of empowerment.
Can I just say how much I love it when I'm not the one who brings up language? Because I feel like people are so sick of hearing me talking about that. So I'm always so grateful. So thank you, Tiara. But words
did you all
matter.
see
Words
on
matter.
Good Morning America, they said it, like, you can't say diabetic anymore, and I was like, yeah.
Wow.
But
Yes.
we need to be careful with that, because we do need to just add that if, as a person with diabetes, you want to use that word, knock yourself out. No one gets to tone police people with diabetes. Use whatever word you want, whatever terms you want. But we just do ask that people consider more broadly how language does impact. It absolutely does. I mean, oh my gosh, the term non-compliant. I really have this thing when I'm at diabetes conferences. I want to ring a bell when that terminology is used by, in research and in, clinical. I just, what that is saying, there is so much underneath that is problematic, and that contributes to stigma, bringing it full circle. But yeah, I just think that we've still got a long way to go, but thank goodness we're talking about it. Thank goodness we're talking about it.
Can I add one more thing?
Yeah. Of course. We have a few more minutes, and I just want to get a couple of minutes in at the end, but go for it.
Okay, so this also extends to like things like complications too. So literally there is not one person who has diabetes that has not thought about complications at least one time. So, and I think this is mainly for people without diabetes. It is very distressing for people to just casually mention, well, with diabetes, people get their foot cut off. People get go blind and stuff like that. And it's just like, I'm not trying to hear that. I know. Thank you. Like, are you going to do something to help me, try to prevent or delay it? And also, if you see someone who is experiencing complications, the best thing you can do is be compassionate and not let that person feel othered. I think there's another campaign that Renza is a part of, talk about complications. And I think for us in the diabetes community, I think we need to see more of those stories too. More of those stories of people who have suffered from or experiencing complications, and are going to help us destigmatize that as well. Because I think that's also something that's prevalent within our own community.
Yeah, I definitely agree, especially when we think about complications. Complications aren't what they used to be 20, 30 years ago, right? So, I mean, we know people that are on dialysis and they're still able to travel around the United States and still get their treatment. So those stories we need to tell, because I think the more of those stories that we hear and that we share, the easier to be to get people to come and share their story in platforms like this. I think for me, I would like to add to everyone here that's listening and to us here is to make sure that we're allowing spaces and providing spaces for people to share their stories, so their stories can be heard. Encourage them to share their stories. I think that, and I never am a plugger, but there was just a recent YouTube video that I just recorded with Scott Johnson about sharing stories. That it's only 8 minutes, so if you have a second, I highly encourage anyone out there who's listening to go check it out. Julie, Renza, Tiara, thank you so much for sharing tonight. We really appreciate it, and it was amazing dialogue, and just thank you. And also to everybody still listening, thank you so much for hanging out with us until 9:30 at night on a school night, or not a school night, work night. Gosh, sharing my age. I hope that you really enjoyed it and be on the lookout for the next one. So thank you so much, everybody. I really appreciate you all.